Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Leg injuries and disorders. Introduction. Your legs are important for standing and movement. Common leg injuries include sprains and strains, joint dislocations, and fractures. Injuries can affect the entire leg or just the foot, ankle, knee, or hip. Certain diseases also lead to leg problems. Some leg problems that are common in older people can cause pain and limit your range of motion. The veins in your legs can also be affected and lead to certain health conditions. This program explains leg injuries and disorders. It discusses the anatomy of the legs, common causes of leg pain, and how to keep your legs healthy. Anatomy of the legs. Your legs are made up of bones, blood vessels, muscles, and other connective tissue. Blood vessels carry blood from the heart and lungs to the legs. The blood nourishes and cleanses the body's tissues. The femur, or thigh bone, is a large bone in the upper leg. It connects the knee joint and lower leg bones to the pelvic bone, or hip joint. The bones in the lower part of the leg include the tibia and a smaller bone called the fibula. The hamstrings are the muscles that form the back of the thigh. They allow you to flex your knee and hip. The inner thigh muscles are called the adductors. The quadriceps is a group of 4 muscles at the front of your thigh. They allow you to move your knee. The muscles in the lower leg allow the toes and ankles to move. These muscles include the tibialis anterior, a strip of muscle on your shin that allows you to flex your ankle. Extensor digitorum longus, a muscle that connects the leg to the foot. Gastrocnemius muscle, which gives your feet the ability to take steps. Soleus muscle, which works with and lies under the gastrocnemius. There are also ligaments and tendons in the legs. A ligament is a tough band of tissue that holds bones or organs in place. A tendon is a cord of tissue that attaches muscle to bone. Leg pain. Leg pain can be constant or intermittent. It may develop suddenly or gradually. The pain may affect your entire leg or just one area, such as your shin or your knee. Leg pain can also take a number of forms. You may feel an aching or tingling feeling in the leg, sharp or dull leg pain, stabbing leg pain. Some leg pain is simply annoying, but more severe leg pain can affect your ability to walk or to put weight on your leg. Most leg pain results from injuries, wear and tear, or overuse. Talk to your healthcare provider if you have pain during or after walking, pain that gets worse or does not improve after a few days, swelling in both legs.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Leg injuries. Playing sports, running, falling, or having an accident can damage your legs. Common leg injuries include fractures or broken bones, joint dislocations, muscle cramps, pulled or torn muscles, shin splints, sprains and strains, tendon rupture or tear. Seek medical help right away if you are unable to walk or put weight on your leg, have a leg injury with a deep cut or exposed bone or tendon, have pain, swelling, or redness in your calf, hear a popping or grinding sound when you injure your leg. Leg disorders. Certain diseases can lead to leg problems. For example, knee osteoarthritis can cause pain and limited motion. This disorder is common in older people. Other disorders that can affect the legs include edema, restless leg syndrome or RLS. Problems in the spine can cause pinching of the nerves and can lead to severe leg pain and weakness. This is commonly known as sciatica. Problems in the veins in your legs can lead to varicose veins or deep vein thrombosis, or DVT. Varicose veins are swollen, twisted veins that you can see just under the skin. DVT is a blood clot that forms in a vein. Most deep vein clots happen in the lower leg or thigh. A DVT can break loose and cause a serious problem in the lung called a pulmonary embolism. This can lead to death. Sitting still for a long time can make you more likely to get a DVT. Some medicines and disorders that increase your risk for blood clots can also lead to DVTs. Peripheral artery disease, or PAD, is a common circulatory problem. When you develop the condition, your legs do not receive enough blood flow. This may cause leg pain when walking. PAD is also likely to be a sign of a more widespread buildup of fatty deposits in your arteries. Diseases such as PAD, diabetes, infections, or cancer could lead to the death of tissue in the leg. When this happens, the leg will become cold and painful. This may mean that the leg has to be amputated. You should seek medical treatment if you have a leg that is swollen, pale, or unusually cold, calf pain, particularly after sitting for a long time, signs of infection in your leg, such as redness, warmth or tenderness, or a fever, swelling in both legs along with breathing problems. Self-care. Minor leg pain often responds well to home treatments. To relieve mild pain and swelling, stay off your affected leg as much as possible. Try over-the-counter pain relievers such as ibuprofen. Apply an ice pack or bag of frozen peas to the affected area for 15 to 20 minutes 3 times a day. Elevate your leg whenever you sit or lie down. Lifestyle habits can help you keep your body and your legs healthy. To prevent plaque buildup and allow enough blood to flow to your legs, do not smoke and avoid secondhand smoke. Eat a healthy, low-fat diet. Controlling diabetes and other diseases can help decrease the chances of leg disorder complications. Maintain a healthy weight. Every pound that you are overweight puts about 5 extra pounds of pressure on your knees. Exercise regularly and safely to develop strong and flexible leg muscles. Talk to your healthcare provider about leg exercises that are right for you. Activities may include balance exercises, such as yoga, leg strengthening exercises, riding a bike, running, jogging, or walking, swimming. Wash your legs every day using soap and warm water. Apply lotion to dry skin. Take a few minutes every day to massage the muscles in your legs. The right shoes and socks can protect your feet and keep your legs healthy. Wear comfortable shoes that fit your feet. The toe end should allow all toes to wiggle. Avoid crossing your legs when sitting to prevent varicose veins. Wearing loose clothing and avoiding long periods of standing can also help. Medical treatments. Some leg injuries and disorders may require medical treatment. Broken bones may be treated with a cast or splint. Sometimes surgery is needed to put in plates, pins, or screws to keep the bone in place. It depends on how severe the break is and where it is located. Tendon rupture may also be treated with a cast, depending on which tendon is affected. Surgery is often needed to stitch the torn tendon back together. Treatment for edema depends on the cause. Your healthcare provider may recommend keeping your legs raised when sitting, wearing support stockings, and limiting how much salt you eat. Restless leg syndrome may be treated with lifestyle changes, including regular sleep habits, relaxation techniques, and exercise. If those do not work, medicines may reduce symptoms. Treatment for deep vein thrombosis includes medicines to break up clots, ease pain and inflammation, keep new clots from forming. If you are taking a long car or plane trip, take a break and walk or stretch your legs. Drink plenty of liquids. Peripheral artery disease may be treated with medicines that control blood sugar levels, lower cholesterol or blood pressure, prevent blood clots, relieve symptoms. In some cases, treatment may also include surgery. Leg pain due to spine issues may respond to physical therapy and injections of steroids around the nerves. A surgical operation may also be needed.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Your legs are important for standing and movement. Your legs are made up of bones, blood vessels, muscles, and other connective tissue. Leg pain can be constant or intermittent. It may develop suddenly or gradually. The pain may affect your entire leg or just one area, such as your shin or your knee. Most leg pain results from injuries in joints or bones or in muscles, ligaments, tendons, or other soft tissues, wear and tear, overuse. Certain diseases also lead to leg problems. Some leg problems that are common in older people can cause pain and limit your range of motion. The veins in your legs can also be affected, which can lead to certain health conditions. Minor leg pain often responds well to home treatments, but some leg injuries and disorders may require medical treatment.
Thank you for using Explain.